welcome back to the Men's Health Hub. Today we're going to be talking about the inguinal hernia. This is the anatomy and physiology, and let's start with the basics. So an inguinal hernia occurs when the abdominal contents, typically a portion of your intestine or fatty tissue, start to protrude through a weak point in the inguinal canal. The key structures involved here are the inguinal ligament, which forms the base of the inguinal canal, the inguinal canal itself, which is this passageway in the lower abdominal wall containing the sperm cord in men and a round ligament in women. And then there's a triangle called Hasselbalch's triangle, which is an important landmark for differentiating between direct and indirect hernias. So I've just mentioned there's two different types. The most common type is congenital in origin, passing through the deep inguinal ring into the canal. And then there's the acquired type, typically caused by weakness in the posterior wall of the inguinal canal. Now, it revolves around an increased intra-abdominal pressure and weakness in the abdominal wall. So this is just the tissues are getting lax, and it can result from chronic straining whenever you're going to the bathroom, heavy lifting if you're doing any high-powered weight exercises, or age-related weakening of connective tissues. So inguinal hernia is going to happen more often as you age. Generally speaking, what you're going to experience is a bulging in the groin that's more prominent whenever you're standing or coughing. It can bring pain and it can bring discomfort, especially with exertion or with straining. And in severe cases, bowel obstruction and incarceration can occur. Now, there are several factors that contribute to the development of an inguinal hernia. There's congenital factors, which will be the failure of a part of the anatomy called the processus vaginalis to close. So this is just that the tissues haven't closed properly, and that allows the intestines to descend. It can be because of increased intra-abdominal pressure. So this is chronic coughing, which you might get with COPD, constipation, heavy lifting, or with obesity. Age plays a factor, as I mentioned earlier, and men are significantly more likely to develop inguinal hernias than women, which is why it's in the Men's Hub. And then there's connective tissue disorders. So anybody that suffers from Ehlers-Danlos syndrome or Marfan syndrome, then you might be more prone to an inguinal hernia. Now, when it comes to treatment, usually it's a surgical repair as the primary option, especially for symptomatic or complicated hernias. And there's two main techniques. There's the open herniorrhaphy, traditional open surgery involving mesh reinforcement to prevent reoccurrence, or there can be laparoscopic repair, which is a minimally invasive option with a fast recovery time and has less post-operative pain. As for asymptomatic hernias, then generally speaking, we're going to introduce a wait and watch approach. But there is always a risk of progression, and you're definitely wanting to go and strengthen those tissues. The complications I mentioned a little bit earlier, so bowel obstruction, incarceration or strangulation of the intestinal tract, and that will require surgical emergency. When it comes to herbal and functional medicine and what we can do about it, there's a few things that won't fix the hernia, but they can support the tissue integrity and they can reduce inflammation and alleviate symptoms. So herbs that are astringent for tissue tone might include herbs such as sumac, which strengthens connective tissue. It could include things like witch hazel applied topically to try and reduce swelling and discomfort. And there's a great herb, Centella asiatica, which is perfect for tensile strength of connective tissue. Anti-inflammatory and analgesic herbs can be used here, so herbs such as turmeric or frankincense that are helpful for chronic inflammation and for pain relief. And then we might want to look for digestive support to ease the straining and make sure it's easier to go to the toilet. So Plantago psyllium husk is quite good at helping to create a gentle bulk forming laxative, and then fennel can really help with alleviating bloating and discomfort. When it comes to nutritional support, we want to put in collagen-rich foods, so bone broths, sea veg, anything that's going to help connect or support the connective tissue. You want to consider herbs such as vitamin C, zinc and silica for wound healing and for tissue strength. And then probiotics might be helpful to maintain good gut health and preventing constipation in the future. When it comes to core strengthening, gentle exercises on the transverse abdominis can really help reduce strain on the abdominal wall, and it is important that you avoid heavy lifting or high impact activities. Reducing abdominal fat can be really helpful, and managing stress to ensure tissue repair and immune function is at your optimum levels. And that's really it. When it comes to diagnostics, the physical examination here can be done from some of the ultrasounds and x-rays, but also very easy to do is to stick a finger up through the sac of the testes into the inguinal area and have a feel around for them and see if there's anything bulging through the ligaments there on the pelvic floor. That's it for now. On that happy and merry note, take it easy.